Let's move to our fourth stop, which will highlight another characteristic of good social innovation projects, which is a project that communicates its impact well. We stay in the UK and we will have the chance to meet Emma Jones, Head of Insight, and Vicky Faminu, Head of Sexual and Reproductive Health at Metro Charity in London, a partner of the SHIFT project.
SHIFT stands for Sexual Health in the Over 45s. The SHIFT partnership wanted to improve sexual health and well-being of people aged over 45 specifically, and particularly those who are vulnerable to poor sexual health outcomes. 129 people aged over 45 participated in the initial qualitative research on sexual health lived experience and needs from both the general population and target marginalised groups, including migrants and refugees, people experiencing homelessness, drug or alcohol misuse, and also LGBTQ+ people. A pioneering new model of sexual health practice for engaging people aged over 45 was created to improve equality of health outcomes. A comprehensive virtual training package for healthcare professionals was produced and delivered across the partnership's regions. This was undertaken by 778 healthcare and wider workforce professionals. A key communication tool we used in this project was filmmaking. Translating the content of research focus groups and interviews with over 45s into dramatised scenarios, and we produced 6 short films. Each drama tackles a key topic which emerged from the research: intimacy, menopause, new relationships and HIV positive status. We also made a film on migrants' inequalities in accessing information about STIs and testing services, and also the stigma around older people testing for STIs and ageism. The films alone have had almost 3,000 views over the course of the SHIFT project, and that engagement and dissemination is ongoing.
The sexual health model developed by the SHIFT partnership was piloted in a variety of public locations in the UK during summer 2022. This included high streets and other locations specifically targeting marginalised communities such as the LGBTQ+ Pride. A key outcome from this was engaging and referring isolated groups. So we were able to meet with many isolated over 45s who didn't naturally have supportive social groups and actually needed the engagement. We were able to identify referral pathways such as local sexual health clinics and services and broader health services such as menopause, and a key topic was pelvic floor issues. Another key outcome was overcoming barriers and stigma. We found that a number of people that were sharing their experiences were quite grateful to have the opportunity to talk about it with other people they met on our outreach store. Another key learning point was our own unconscious biases and how we needed to tailor our approach to different communities, considering issues such as culture, religion and other identities. Another key finding from the project was how conservative members of society were talking about the topic of sex for an otherwise quite progressive community. So we had to make ourselves especially relatable and approachable. So the use of humour was a really good tool for this, as we used playful tools such as eggs for pelvic floor exercises, sex toys, lube, sweets, and condoms, and anything else that helps stimulate conversation. These conversations were really engaging and allowed members of the community to actually talk about topics such as prioritising women's pleasure, which they otherwise wouldn't. So another key outcome was destigmatising age and actually addressing the topic of age in a humorous way. Unlike many of the generations that came after them, they weren't provided the opportunity of sexual reproductive health education, and so are currently benefiting from new age of sexual health renaissance. We were also able to have some really fun conversations with mums seeking condoms for specifically their sons, but also using that as a tool to engage them on their own sexual health needs, such as their pelvic floor and the impact of menopause.
Thank you very much, Emma and Vicky, for your very complete and detailed intervention. Having to deal with different target groups requires a strong focus on communications indeed.